You're listening to Thyroid Talk with Dr. Angela Mazza.
Welcome, I'm Dr. Angela Mazza, a thyroid, endocrine, and metabolism specialist with an integrated practice in Central Florida. Today's topic is brain fog and the thyroid. As our listeners know, my goal for this podcast is to define and demystify the thyroid gland and thyroid-related medical conditions. By providing information in an easy-to-understand format, I hope to help patients better understand the ways in which their bodies work and to help them thrive. I'm glad that Dawn Sheffield, my friend and co-host,
and patient,
is here with me for episode 11.
Well, thanks for inviting me to join you again. I know our topic today is brain fog and the thyroid, and we're just about to get into that, but before we get started on that topic, I hear we got another valuable listener question.
We did. Here's a great question from a listener in Central Florida. Our listener says, I think a so-called incidentaloma is a growth found accidentally, incidentally, while looking for something else. Can an incidentaloma on an adrenal gland have a negative impact on adrenal function, or is it usually nothing to worry about? Well, incidentalomas, like our listeners mentioned, are accidentally found masses on the adrenal gland. And the more imaging we do, the more of these we find. And usually they're nothing to worry about, and they're just there, and they may have been there for years. But the regular course of action is to evaluate these masses to make sure they're not making too much of something. So when we discussed about cortisol, that comes from our adrenal gland. So some of these adrenal masses can make too much cortisol, too many catecholamines, sometimes too much aldosterone. So that's an evaluation that an endocrinologist usually handles. If that comes back negative, then generally we recommend repeat imaging in maybe 6 months to a year, and then maybe another year after. If nothing changes, then they just kind of are there and it's not anything to worry about.
Well, our listeners are amazing, and that is great question. I would never have thought of that question.
That's good. Our listeners are extremely insightful. That's the one reason we love listener comments and questions.
Yes, we do. And I'd really like to do a future episode on that topic. It brought up some things that we should explore.
I agree, we'll do.
Well, as for today's subject, I'm glad you asked me to join you on this important and pervasive issue. So for now, just to get started...
Dawn?
I'm sorry.
Are you there, Dawn?
Yeah. Physically, I'm right here. But I've lost the thread mentally. The subject. Is it foghorns?
I'm pretty sure that's not it.
Great horned owls? We like owls on this show.
No, not on this one.
Okay, pollution. Did I say foghorns? Smog. Brain fog. There we go. Brain fog. Phew, that was quite a ride on my Brain Fog Express. And I'll tell you what, I'd sell tickets on my Brain Fog Express if I could remember the price of the tickets from one day to the next. I wish I could say that process I just demonstrated of groping one's way back to a subject never happens to me. I wish I could say that it never happens, but it does sometimes happen. I used that exaggerated, maybe not so exaggerated example to illustrate what an episode of brain fog might feel like, at least for some folks. Happily, it's pretty rare for me, but memorable when it does happen. Oh, and see, I said memorable because no pun intended.
Very
it's
clever.
Probably not, well, accidental, probably not memorable. Not at all, probably easily forgotten, lost in the fog.
Often patients also explain it to me like this. I feel like spaced out. Or, I know what I want to say, but I just can't find the right word. And I can't even complete simple things now, but they used to be a breeze. So if this happens just occasionally, say you find yourself in the kitchen and can't recall why you went in there, or you can't find your glasses and they're on your head, well, welcome to being human. We all do these things from time to time. Maybe your sleep the night before was interrupted, or you just didn't get enough caffeine or coffee that morning. Or maybe you're just having a bad day, or juggling way too many tasks.
But sometimes, you know what, we may suddenly stop in the middle of a story. This is more common for me. I think just stopping in the middle of a story and saying, why am I telling you this story?
Where was I going with that?
Where was I going with that? Well, you know what? The other person doesn't know, do they? Because they haven't heard the story yet. What was my point? It's like we fall into a deep hole. We might have been enjoying the chat till we realize we're trapped in it and can't find the path out. It's not even the chat we start out having. It's disturbing to realize we're telling somebody something that was not the thing we set out to tell them. I personally find this very disconcerting when it happens. Usually the story that's the unintended story then just peters out because I'm so embarrassed and annoyed and distracted because I'm trying to remember what the thing was that I was trying to tell them. It just runs out of steam because it's not the right subject. It's a terrible feeling in that moment and so distracting.
You know, sometimes, like when we're just juggling too many things, our cognitive function sort of short circuits or gets overloaded for just a minute.
And that's when it happens to me the most often. I actually gave this a lot of thought to try to analyze, if I could come up with some common denominators in situations when it happens to me. And I've noticed, especially if I'm stressed or with an unfamiliar person or in a situation that might not be super familiar to me, or if there's pressure. Let's say I'm trying to teach someone something in a short time frame. That's where the pressure comes in.
Mm-hmm.
And then something like a related but off-topic side story interrupts the flow. And that actually happened to me just recently.
But when episodes similar to these happen a lot and for extended amounts of time, well, a person may be suffering from what we call brain fog.
I often wonder, Dr. Mazza, if listeners think we only do topics for which I have some embarrassing story. It seems like that. But no, I just happen to have an embarrassing story to fit nearly every occasion. And I could not make these things up, nor would I want to, frankly. So here's what happened a couple weeks ago. I was telling a friend about our episode 10. The one on cortisol and stress.
That was a good one.
It was a good one, and I was really excited about it. It was quite a detailed account that I gave them, and I was really into it. I had zero trouble remembering all the details, likely more than they wanted or needed, frankly. And that sort of led me to feel like it isn't necessarily a memory. It's not the same as a memory problem where you can't remember that what happened in a thing that you enjoyed. But what happened here was a moment earlier, before we were talking about that episode, we'd been talking about a different episode entirely. And that's the subject I really wanted to get back to. I could not wait to tell her about the next episode we were already working on. That's the episode that came after cortisol and stress. And you know the one about oh my gosh.
Come on.
What was it about? And more important, where was it? It's like my brain had just swallowed it. It seemed like the topic I wanted to discuss had been literally on the tip of my tongue, right up front in my mind. But a huge, opaque door slammed down between us like a cleaver. For about 20 seconds I just sat there and I was just mortified. I completely lost the subject of the episode that I myself was working on with you. And then, it came to me. The topic I was trying to remember, you guessed it.
Mm-hmm.
Brain fog. It was a little bit funny considering the subject, but mortifying too. And it was a bit troubling because that same week I'd had such an amazingly good memory. My husband had asked me a bunch of extremely obscure history and movie questions, just, conversationally, and I effortlessly pulled those equally obscure answers right out of my brain, and I really thought, I've reached some sort of unprecedented level of brain clarity. I was so proud. I thought, well, I've cleared some sort of neurological logjam, but no. The thick, relentless fog rolled in just a few days later when I was talking to my friend about brain fog, of all things. So disappointing, and brain fog just has no respect for us at all.
It really doesn't. But we have to respect brain fog because it can be a sign of something going on in our body that we need to figure out and correct. Both uncontrolled hypothyroidism and hyperthyroidism can be associated with significant changes in mental clarity and function, as well as mood. Lots of times, adequate thyroid therapy and bringing thyroid levels back to a more normal thyroid state can return these symptoms to baseline. That is, to their formerly normal range. Believe it or not, untreated hypothyroidism can actually cause structural changes in our brain.
Oh, I don't doubt that at all.
I know. Thyroid hormone is extremely important in pregnancy for normal brain development of the fetus. So women with hypothyroidism need to be monitored really closely throughout pregnancy, at least throughout the second trimester, because baby's brain development depends upon mom's thyroid. Plus, mom's thyroid demands change and increase throughout pregnancy due to binding proteins influenced by baby. Remember thyroid binding globulin? Well, that goes up during pregnancy. Oftentimes, mom's thyroid dose needs to be increased during pregnancy.
Regarding those binding proteins, do you mean that the fetus exerts a sort of pull-away effect? No, that's not the technical term there. Like a pull-away effect on the mother's thyroid hormones, resulting in more thyroid hormone for the baby, but a possible shortage for the mother, so she might need to be given more?
Yeah, kind of. Remember how thyroid hormone circulates in a bound, meaning bound to protein, or in a free form? Well, proteins produced by the baby increase the bound portion, meaning less free portion. Therefore, oftentimes we need to increase a mother's thyroid hormone replacement throughout pregnancy. This is important for the mother, but really even more important for baby's development of crucial organs like brain, heart, etc. Additionally, studies suggest that adults with hypothyroidism show alterations in hippocampal function and significantly smaller hippocampus volumes. The hippocampus is a part of the brain that's extremely important regarding memory, which may account for the memory deficits in persons with long-standing untreated or inadequately treated hypothyroidism. This is an area that is understudied, so we don't completely know if these changes return to normal with adequate thyroid replacement. So stay tuned on this matter.
Well, you and I talk a lot about various types of inflammation, and I wanted to make the point that inflammation is not in itself an evil to be feared and conquered at every sighting, though I do sometimes feel that way. Inflammation can actually be an entirely natural and helpful process that the body performs to protect us. Like, if you twist an ankle, it may swell up to stop you from using it for a while, and it hurts a lot. But it may be ultimately helpful. It's a sharp reminder, let this rest, give it time.
Right. It's when the inflammation is not controlled and not helpful, when it's not necessary, as in autoimmune disorders. It's not helpful to have our immune system fighting us instead of, or in addition to, real threats. It can seem scary, but in fact, brain fog is a term we use to describe neuroinflammation. That is inflammation of the brain.
Yes, that sounds scary. It really does.
Mm-hmm. And it can be linked to thyroid function, thyroid malfunction. But it can be linked to lots of other causes as well. They're not all too scary, and some are remedied fairly easy. Here are some of the possible causes of brain fog or neuroinflammation. It includes stress, lack of sleep, poor diet. Certain medications can cause brain fog. Micronutrient deficiencies, autoimmune disease, hormonal imbalance, liver disease, anemia, depression, diabetes, dementia, dehydration, toxin and biotoxin exposure can cause brain fog. It could even include post-COVID syndrome. So many folks have been experiencing brain fog in addition to fatigue after COVID.
Right.
Usually it's short-lived, but it can be very frustrating. COVID is such an inflammatory virus, it makes sense that it could cause some brain fog.
And I know folks joke about brain fog, and I have too, guilty. But it's not funny at all when it's related to COVID. It's not funny when it's really debilitating, not just an occasional memory lapse here and there. It's not really funny for any reason.
Right.
It can be very serious. Brain fog, as you said earlier, can range from periodic mild lapses in concentration to much worse episodes. It might make a person wonder if they're getting dementia or Alzheimer's. Maybe we might even imagine having a tumor or a neuromuscular disorder. Not to mention the social embarrassment, which I think can be significant.
Right.
I mentioned earlier that I was discussing this show with a friend, and when I went to talk about the brain fog episode of all things, I forgot what I was trying to say. We laughed it off, but 2 weeks later, with the exact same friend, it happened again. I keep saying the word mortified. Apparently I was really mortified because I keep using that same word, and to say that I was would be an understatement.
Well, it can be embarrassing and again frightening. And in fact, dementia can be a possible cause of brain fog. But there are lots of other possible causes too. It's not always the thyroid, not always an autoimmune thyroid disease that's the culprit, but it can be.
And is the brain actually inflamed? And I just want to say real quick here that brain fog almost is kind of a funny sounding term. Neuroinflammation is not.
Yeah, it's a little more serious sounding.
And so now we say neuroinflammation instead of brain fog. Now I just don't feel funny at all. I feel a little, scaredy. So is the brain actually inflamed? Like the swollen, sprained ankle we mentioned. I'm just trying to imagine it.
Actually, neuroinflammation occurs when the brain's own innate immune system becomes activated. That can happen when the brain encounters a challenge it feels it must fight.
Can neuroinflammation be measured? Like, maybe in a scan, for example?
Good question. In research studies, imaging like special magnetic resonance imaging, or MRI, can give an idea of brain fog. But no, there's not a standardized measuring or imaging, at least for now.
We talked last episode 10, about stress and cortisol levels and how stress can have a really debilitating effect on our bodies that have not evolved since our caveman days.
That's right. And stress can have a lot to do with why we so often have brain fog in our modern life. The reasons are vastly different from our cave-dwelling history, but the effects are the same. There are so many possible causes of brain fog that we must carefully evaluate them all and rule out whatever doesn't apply. It's crucial to determine the actual cause. We really shouldn't dismiss it if it has reached a troubling point.
Agreed. But you know what? Someone I know was joking about it some time back, and I'm not talking about myself right now. And I realize now in retrospect, her laughing about it might actually have been an attempt to disguise or soften a very real fear, loss of mental capacity. And I think that's likely true for most of us. Even finding those lost glasses on top of one's head is a bit upsetting. Sometimes making a joke at our own expense might make the subject feel a little less terrifying. And prior to this episode, I'd never connected inflammation to brain fog. I did not know that brain inflammation in this context was even a thing. And I kind of wish I could unknow it.
Sorry.
No, it's okay. Got it. I'll get a grip on it. Still, I wasn't really surprised to learn from you that it does exist and that the two are connected. And you know how with leaky gut, you might sort of... That brought leaky gut up again. Woohoo!
You just can't get away from it.
I can. I'm going to give myself a star. You know how with leaky gut, you might sort of assume you have it if you are a Hashimoto patient, only because it's so common amongst us. But with brain fog, we must not assume it's thyroid-based because it might be so many other things. Right. You really have to get the right answer and really get to the bottom of that.
Yeah, especially because some of the possible causes are really easily treated. At least in comparison to some of the others, that is.
Well, that's good. That'll be my takeaway. What sort of tests exist to help you get those answers, though?
Well, it's first important to rule out some of those other causes of brain fog that we mentioned, like meds and anemia, for example. But like I said earlier, there's no one single test to diagnose and evaluate brain fog. There are cognitive assessment tests that are helpful. Studies are ongoing to establish testing specific for thyroid-associated brain fog based on certain scales, like tiredness, anxiety, depression, emotional susceptibility, impaired social and daily life. But again, stay tuned for more information on this.
Our listeners know that we do not like to talk about problems without also discussing potential repair kits.
Right.
What do you recommend to your patients to minimize brain fog? And what treatments or options are available to them?
There are things I recommend to some of my patients to help, quote-unquote, lift the fog. In general, the key to treating brain fog is addressing the underlying cause. Because when we're dealing with thyroid disease, balancing thyroid hormones is key. But it's still important to rule out other causes, like those listed previously in this episode. There are some basic things that are good to start with. First, and I feel like I say this all the time, try and get plenty of adequate restful sleep. Try to keep stress under control as much as possible. Regularly do some physical movement. You can never go wrong with moving more. Maintaining sufficient micronutrient intakes, that's our vitamins and minerals. Limit those inflammatory foods. They cause inflammation. The inflammatory foods are sugar, alcohol, and gluten. Those are the biggies. Try and detoxify on a regular basis. Easy way to do that is just make sure you sweat every day. Use your brain with activities like reading or brain puzzles.
I know what detoxifying means in general, but what does it mean in regard to the thyroid, and how often is it appropriate?
Well, think of detoxification as a reset, kind of clearing out those toxins, decreasing inflammation, and creating an ideal environment for optimal function. And in the case we're talking about, for proper functioning of the thyroid. I recommend detoxification on a regular basis. And like I said, this can be as easy as sweating every day and limiting those inflammatory foods. There are more intense detoxifying protocols, which can be as long as 7 days to a month. The frequency of these protocols can be recommended based on an individual basis. But what's really important to understand is that specific to autoimmune thyroid, how high a patient's autoantibodies are gives some insight to the degree of neuroinflammation. Sometimes persons with higher thyroid autoantibodies can experience more brain fog. The thyroid autoantibodies are associated with autoimmune activation. The more we actively work to control inflammation and induce immune self-tolerance, the better results in lifting the fog.
Immune self-tolerance is a new term for me. I had never heard that, and I cannot even guess what that is.
Well, there are two main arms of the immune system. The one that helps us fight off infections, like viruses, bacteria, etc. Then there's the other arm that helps us not fight our own tissues. When this arm starts to go awry, that is when we start to see antibodies produced against our own tissues, hence the emergence of autoimmune diseases like hashimotothyroiditis. All the therapies we have discussed thus far, hormonal balance, micronutrient replacement, stress management, addressing the gut, and so on, can be beneficial in most cases of neuroinflammation. But I also sometimes recommend a therapy known as low-dose naltrexone, or LDN for short. LDN is a prescription compounded medicine, meaning that your provider has to send your script to a compounding pharmacy that is reliable. A quick side note about compounding pharmacies in general. As we said in episode 6, a compounding pharmacy is a pharmacy that makes specific doses of medications that are tailored to a person's needs. Pharmacy compounding is a valuable option when it comes to thyroid and other treatments. The beauty of compounding is that with a reliable compounding pharmacist, medications can be tailored to fit a specific person's needs. It doesn't have to be just an off-the-shelf, one-size-fits-all dosage or compilation. Some meds, like thyroid hormone formulations, for example, can be compounded into different types of capsules, including gluten-free and sustained release. And depending upon the pharmacist, tablets can also be an option. But word of warning, it is very important to go to a reliable compounding pharmacy. There are only a few that I personally use on a regular basis, so ask your healthcare provider for a trusted source and do your homework ahead of time. Having said that, let's get back to discussing low-dose naltrexone, or LDN. LDN is a non-selective antagonist of the opioid receptors. That means it increases circulating opioids in our system. At high doses, it blocks opioid receptors and increases our body's natural painkillers, endorphin and enkephalin. These natural chemicals interact with our brain's receptors to help us feel more focused and experience less pain. Naltrexone is traditionally used as a rehabilitation therapy for persons with addiction issues, like alcoholism. It is also used in combination therapy with bupropion for help with weight loss. LDN helps to lower inflammation on a couple of levels. In our central nervous system, it helps to decrease neuroinflammation or inflammation of our brain. In our peripheral nervous system, it regulates our immune system. Remember that our gut houses a great majority of our immune system, so much of the immune effects of LDN are at the level of our gut. Dawn, all roads lead back to leaky gut.
I'm telling you, that's how it is. That's how the whole thing goes. And I have mixed feelings about that, which I'll just say, increasing leaky gut knowledge and awareness makes me happy. Yes, it does, but frankly, I'd be even happier if leaky gut did not exist and we never had to discuss it again.
Oh, I think you'd be sad.
No, I don't think I would. No, well, maybe for a few minutes, but I'll find a new topic.
You get over it.
I'll get over it.
But I do agree. And I have to think about leaky gut a lot because my Hashimoto
You do.
Because Dawn makes me think about leaky gut.
Sorry.
But I do think about leaky gut a lot because my Hashimoto patients are particularly prone to it. So LDN has been studied in regard to several autoimmune-related conditions, including multiple sclerosis, inflammatory bowel disease, fibromyalgia, and type 1 diabetes. Although there's not much available research on LDN and autoimmune thyroid disease, the same principles apply and make it an additional tool in our toolbox. Much of the benefit of LDN and autoimmune thyroid disease is most likely a result of beneficial gut changes. In hashimotothyroiditis, LDN is especially useful for persons that experience symptoms like brain fog. LDN over time can help with mental clarity. LDN's effects can be measured by following levels of thyroid peroxidase antibodies and thyroglobulin antibodies. As the antibodies trend down with LDN, so do symptoms associated with brain fog.
I'm assuming that LDN does not replace one's thyroid medicine, but rather augments it?
True. Don't stop your thyroid medicine if you start LDN. LDN works towards the autoimmune component of hashimotothyroiditis. It helps bring down the autoantibodies of autoimmune thyroid disease. So remember, that's our anti-TPO and TG antibodies.
What are your most important takeaways for listeners regarding neuroinflammation, that is brain fog?
Okay, well, really important to note that ignoring the symptoms of brain fog can, over time, greatly reduce the quality of your life. You may no longer feel confident to make long drives that you used to really enjoy, or you may feel uncomfortable in social situations. These are just two examples. Brain fog might also be a sign of something else that needs to be addressed before it progresses. That's especially true when it comes to thyroid imbalance and autoimmune thyroid disease. The silver lining is, with treatment and some efforts towards self-care, brain fog can be greatly improved. And though it may take significant time, it is a crucial program to undertake. You may even get back to your previously normal brain function or close to it. Well, listeners, you have our sincere thanks for sharing your time with us. I hope this discussion was helpful. Let us know. In our next episode, we'll cover the benefits of exercise. I love exercise.
I just bet you do. I can just imagine that you do.
I wanted to do this podcast to provide life-saving education and to encourage folks to see a doctor in time to prevent or minimize damage. That's deeply fulfilling. I enjoy helping folks understand how all aspects of their lives are tied to both thyroid and overall health. As always, my goal is to help us live more fulfilling lives by taking control of our health and thus feel our best. In fact, that's why I went into endocrinology. It's a medical art that combines science with the study of our lives and all it may encompass.
And I do like the elliptical. I'll just throw that out.
I'm a fan.
I know you are. I know. And it was just funny. We had that in common. I didn't realize that, and other things too, which we will talk about in our next episode. So we hope you'll continue listening to Thyroid Talk with Dr. Angela Mazza. We have many more interesting episodes planned. We'll build on today's foundation and cover many topics we hope you'll find meaningful. To recap just some of what we covered here, not necessarily in this order, what is brain fog and what are some of the causes? What are some of the symptoms of brain fog? How our thyroid impacts our brain function? How thyroid imbalance can cause brain fog? What are things we can do to lift the fog? What is low-dose naltrexone, or LDN, and how can it help with brain fog in autoimmune thyroid disease? I hope I pronounced that
You did.
correctly. And best of all, we learned that we can impact our thyroid health. As Dr. Mazza mentioned in our next episode, number 12, we'll discuss the benefits of exercise. And as always, we welcome your input. Please send your comments, show ideas, and questions to thyroidtalk.mazza@gmail.com. That's an email address, not a message board. Other listeners won't be reading your messages on any sort of public forum. We may disclose your general location on air, the city or town, for example, but we will not read your name nor your address on the show. We reserve the right to edit your input as necessary. Don't forget to ask your healthcare provider about any specific questions regarding your wellness. This podcast is meant for educational purposes only.